1,568 doctors died in COVID because of treating patients.
Hello, friends. Welcome to the episode 51 of Suman versus Human. Friends, as you know, that doctors play a very important role in the world. They go to any extent to save us. Doctors go through a lot of stress in their personal life. Doctors go through a lot of challenges in the world, irrespective of their mental status, irrespective of their stress, irrespective of their workload, hardships, they always make sure to be readily available for you when you actually need them into your life. Though doctors do all these good things for us, but unfortunately, people always have wrong point of view for doctors. So I want to talk more about this, and I have a very special person today on the show. He is National President of Indian Medical Association, IMA. Suman versus Human proudly welcomes Dr. R.V. Asokan, the President, IMA. Dr. R.V. Asokan, welcome to Suman versus Human.
Thank you, Suman. Thank you for this wonderful welcome.
Today, the media houses, so called media, that also include social media, so called public, the people living on this beautiful planet, so called cinema, the movie industry, everyone all come together and show doctors as an number one exploiters and looters. Despite of the valuable work you do, you are lifesavers, because from the beginning I was told that doctors are next to God, but I don't see such kind of respect being offered to you. Where is the gap? Is this all confusion, or is this all that you doctors are mahan to tolerate all these atrocities, abuses from the people, or is this because you doctors are shameless and come forward to render your great services despite of all these verbal abuses and atrocities you face from the people? What's actually happening?
Right, Suman. That was a pretty straightforward question. Let me address it macro aspect of it first, then going into the micro aspect of myself as a doctor.
Hmm,
What is my response? These are
hmm,
two things.
hmm,
The macro response is that, if you look back into the contemporary history,
hmm,
it was in 1985, the first shareholder business entered, for profit shareholder business entered healthcare. Until then, it was either the government or the small and medium hospitals which were being run.
hmm,
When the big hospitals were run by the government, there was no other competition. The
hmm,
medical colleges were
hmm.
the final say
Yeah.
and very revered places.
Hmm,
And it was in 1985 you had the first business house
hmm, hmm,
entering into shareholders holding a hospital,
hmm,
a for profit hospital, a corporate hospital came into existence.
hmm, hmm.
It was the first mistake in policy wise. They should not have been allowed.
Oh, okay.
They should not have been allowed.
Hmm,
The government vacated its space.
hmm,
They ran away from health.
hmm,
And that has grown like a big Frankenstein today.
hmm,
And basically, the profession
hmm.
is today is an employee.
Yeah.
The small and medium hospitals are disappearing,
Yeah. Yeah.
and doctor entrepreneurs are disappearing.
Hmm,
Today, we are being replaced by all hospitals which are coming up are mostly tertiary or quaternary,
hmm.
all controlled by shareholder holding business.
Yeah.
And they are answerable to their shareholders, and their motive is profit.
Hmm, hmm,
And now to add to this, because of the nature of the expectations of the people, hospital industry has incorporated hospitality industry also.
Oh.
And this industry is run by non-medicals. Hospitals are run by business graduates. They don't have the aptitude or the touch of the medical profession or what it is about. You can't expect a different thing. So the crimes of the for-profit industry is visiting the medical profession. You add on to it what the Supreme Court did in 1993. They let us down. They did not let the medical profession alone. They let down our patients. They declared that in 1993, these patients are actually consumers. See, that was a death knell for the doctor-patient relationship. It made a relationship of a provider and a consumer. Then what is sanctified about it? It becomes a total the legal relationship between a doctor and a patient was defined by none other than the Honorable Supreme Court of India. So we were heartbroken, not because of the litigation, not because of the litigations. Even today that pain is carried by every doctor. That the Supreme Court ruled it in a way that it changed. Generations of doctors are not going to forgive the judiciary for what they have done. They have obliterated the sacrosanct relationship between this is the macro picture. On one side, industry is replacing the profession, and on the other side, the legality of the thing is changing into something else. And the people with their expectations, letting down of the government, and their expectations are growing with what is happening elsewhere in the world, and the cost that they cannot afford, and the private health insurance industry, it all becoming industrialization of healthcare.
Hugely commercialization.
Hugely commercialization beyond the power of the profession, where the profession has nothing to do but become employees of this industry. So this is the macro picture. The micro picture is that the good news is that many of our doctors, we are respected in the communities. We are connected to our patients. In spite of all these challenges, I have hundreds and thousands of patients who respect me. I live in a small town. And I can see the respect when I walk amongst my people. I can see small little gestures would tell me that, I am respected because what I have given to this society. So that is the only silver line. I respect that in spite of the legality, in spite of the business getting into medical profession, that connect is still there. That connect is with the society at the local level. That when you blow it up to a state level or when you blow it up to a national level, that disappears. Because of what the for-profit industry does, because of what the private health insurance industry has come to do, because of what is happening in the legal circles. So this is the picture that I get. But as a doctor, I am not disappointed. I have hope, lot of hope.
Do you agree that there is atrocities and there is verbal abuse on doctors?
That is for sure. That is for sure. We have faced it. My wife is an obstetrician and gynecologist, and there are medical accidents which happen, which are beyond us. But there is very little tolerance to accept the limitations of the medical profession. When something goes wrong, very, God forbid, we have not been physically violated. But
mm,
everything else has been done against my wife. Everything else, you mean anything, social media
mm,
or
mm, mm,
people protesting or public posters
mm,
coming up against her. We have passed through very painful times,
mm,
very painful times, very challenging times, and for unfortunate death,
mm,
we somehow are considered as people who have done a crime equal to a murder.
mm, mm,
That includes the judiciary.
mm,
My wife was sentenced to 1 year in prison
mm,
by the lower court when there was an anesthetic death,
mm,
which was beyond us. Nothing could be
mm.
done about it. Three doctors and three nurses, after a 2 year long trial, they sentenced. But fortunately, at the High Court level, there was a lot of facts which were brought up before the court,
Mm,
which the court ultimately exonerated all of them. But those 13 years of being, criminally being prosecuted,
mm,
in the meantime, trying to, live our life as doctors, upholding the profession, conducting deliveries. Today, she has finished 28,000 deliveries.
ah.
We are 42 years into our practice.
Why, sir? Why? Because when I look at any politician doing any nasty things, I'm sure that he wouldn't have gone through this much of atrocities. But when a health saver, we call them as doctor, if something goes wrong, because no doctor, I'm 100% sure, no doctor will do anything deliberately, but still they have to go through all these harassments. Why discrimination?
Partially, I would say that the falling values inside the medical profession cannot be hidden.
Mm,
It has to be accepted that there has been fallen values of what the erstwhile doctors were and the doctors who are being produced now. Somewhere there is a gap in the values, or maybe with time the values are also changing.
mm,
So that is part of the thing. But by and large, it has become a consumerist culture in the population that I have money, I will buy care.
mm,
But that's not possible. You can't buy care or health just with money. There are so many unpredictable factors which are
mm.
coming up. And of course, it's a free country, free press, and they
Democracy.
do, yeah, they do focus, on a negative thing first,
Mm,
and they have the power to, make it known throughout, and it becomes all emotional, and the patient is considered to be a victim
mm, mm,
of. So the other side is that the social media pressure
mm,
is something new for the past few years or within a
mm.
decade, which is tremendous. Something
Yeah,
like a Facebook is an open market,
yeah,
and your reputation that you earn in or your lifetime is lost over a few seconds.
yeah, yeah.
Yeah, and the laws of this country, the legislations, have a layman perspective.
Mm,
That's, in other words, they don't take into consideration the difficulties of the medical profession,
mm,
the dilemmas of the medical profession,
mm,
and the unpredictableness of the medicine as a career.
mm.
No doctor can say that what will happen in the next second.
Yeah, yeah,
You may say something and you may have to eat your words the
yeah.
next minute. You may say that the patient is fine, but
Mm,
in 1 minute you can see the patient collapsing there.
yeah.
So such things are so common in this profession. There is lot of area which is gray,
Mm,
which cannot be captured by a layman.
yeah.
Another doctor will immediately understand what has gone wrong. But it will be so difficult to explain it to a person other than a doctor of what has exactly has gone wrong. this difficulty of the profession to come into black and white critical analysis by anyone, including a court.
Hmm.
The courts, they take 2 or 3 years to decide on a thing which are objective, black and white.
Yeah.
But for us, the decisions are taken in a split second
Hmm.
where nothing is black and white. I can tell you, nothing is black and white in the medical profession.
Yeah.
Even with all these gadgets, it's all gray. It's all jumping into darkness.
Yeah. I know that doctors, they live compromised life because you need to sacrifice your personal time, family time. So, how difficult for you to overcome all these things in life in order to render medical services to the patient? Is it okay?
Every, yeah, every day is different.
Hmm.
Every day there is a new learning, new dawn, and a new experience. The mere novelty of that keeps us going. The mere novelty of learning something new, seeing a new thing in life. The
Hmm.
same passion with which you enter into the medical college. Why do you enter into medical college?
Hmm.
I think it was Mallory who was asked,
Hmm.
in 1930s,
Hmm.
why, I think he's a New Zealander. He was
Hmm.
asked, why are you trying to climb Everest?
Hmm.
What is there in it? If you don't climb, what is there? What is it making it to climb Everest? He
Hmm.
said, the only reason that I want to climb Everest is that it is there.
Yeah.
There was Mallory back in 1930s. It's something like this is the medical
Yeah. Yeah.
profession. It is there.
Yeah.
The unknown,
Hmm.
the depth of unknown is still remains the same in spite of science.
Yeah.
It has become more rather than less.
Hmm.
So the quest to conquer that unknown, that drives us every day. So the gratitude in the eyes of the patient,
Hmm.
when you make a difference between life and death,
Yeah.
is that cannot be described. That one moment will certainly make us forget. Many doctors work more than 14 hours a day,
Yes. Yes. Yes.
especially the family concerns. There is a group, husband and wife team. This is very common in the medical profession. You
Hmm.
find a clinic, a practice.
Hmm.
Those family concerns, they work for 14 hours a day, even on Sunday, 24 into 7.
You can't even spend quality time with your children.
That is quite true.
Hmm. Hmm.
I still
I
can
suffered
hear
it.
my. Yeah. Oh, yes.
I remember
I,
those days, like, we all family members used to go to movies, and my dad gets a call. He walks away from the theater, leaving us alone in the theater, and he sends compounder or driver to pick us up. All these things happen.
I can. My daughter is a doctor, and my
Hmm.
son-in-law is a doctor,
Hmm.
and they live in Chennai, and I live in Kerala,
Hmm.
and I can still hear her voice at 9 or 9:30 before going to bed.
Hmm.
She will ask, "When are you going to come?" Something
Hmm.
like that. That voice still I can
Yeah,
hear.
yeah, yeah. How easy it is to become a doctor? Is it really easy?
No, no, no. Academically not.
Hmm.
Academically not, because if the amount of hours that you need to spend
Hmm.
before entering
Sir,
the medical colleges.
sir, I'm sorry for interrupting you. You said academically not,
Yeah,
right?
yeah,
Yes.
go ahead.
I just want to
No,
highlight this point.
no, academically, it is like I said, it's as like we are climbing an Everest.
Hmm.
And before medical colleges, also it has become very tough now with the NEET.
Hmm.
Earlier, we had a very simple way
Hmm.
of our marks in those days. It was pre-university exam, PUC.
Hmm. Hmm.
If you get a D plus and a D in all
Hmm.
the science subjects, you are sure to get. It was so simple as that. Only the marks.
Hmm.
Now the NEET UG, you have seen what is happening.
Yeah, yeah.
It's an enormous stress
Yeah.
on the children. Enormous.
Mm.
More than the content, it is the methodology which is baffling.
Mm. Mm.
And the access to need is also, it is not, there is no equity in it.
Mm.
That, it is the English speaking upper middle class
Mm.
which is robbing the medical seats away from my fellow citizens
Mm.
who live in the rural area,
Mm.
who are poor, who are marginalized,
Mm.
and who study in vernacular,
Mm.
and especially girls.
Mm.
They cannot afford the coaching industry.
Yeah.
Now, without a coaching industry, NEET has become almost not. It cannot be done. NEET is a
Yeah.
huge burden on the country.
Mm.
It's a huge burden. It's of course true that the merit has to be considered here. Merit is only one of the criteria. Now we have streams of academic, which is coming in from many states at different levels.
Yeah.
Now trying to give them something like this too elitist examination like NEET UG is very unfair, because even today India lives in so many centuries
Yeah.
simultaneously.
Yeah. Yeah.
India lives in at least 3 centuries simultaneously. Our
Mm.
people
Mm.
live
Mm.
in different strata of development,
Mm.
poverty. So there has to be some equity. It's not equality. Merit
Yeah.
gives you equality. But
Yes.
there is a distinct difference between equality and what is equity.
Mm.
NEET is injustice. That is one way. The second thing is the medical education right now. Even in our days, before 40 years, it used to be difficult. We read, practically, every day it goes on up to a 18 hours slot.
Mm.
And our teachers, they will just assess us like they are assessing gold.
Mm. Mm.
And but we used to love that.
Mm.
And there
Mm.
is, at least I can say that no medical student who used to get out without a failure at least once in his career.
Yeah. Yeah.
And it was very good. It was very good. We all love that college campus
Mm.
because of that effort that we put in there
Mm.
those days. And of course, yeah, post graduation is something like, something which is, mind blowing, where,
Mm.
the volume of science you imbibe
Mm.
in those days, by the time that you understand the human body's dynamics also, in post graduations, you apply those sciences on that living human body, it's a
Mm.
mind blowing experience.
Mm. Mm.
So,
Mm.
aside, this academic nature of the career is too good.
Yeah.
But now there is private medical colleges are more than government medical colleges.
Yes. Yes.
And we have brought in a system for which the doctors are not responsible.
Mm. Mm.
Again, a macro chain in the playing of, pay your way into the medical education is certainly not the best way to get our doctors done. Even otherwise, the entrance examination has already created a lot of things which are favorable to the English speaking
Yeah.
upper middle class elite.
Yes. Yes.
Now, with the privatization of the medical education more than 50%, no, it's a gross injustice to our fellow citizens. Many of them may be first generation literates. How do they do it? How can they
Yes.
do it? Education is the only ladder
Very
which can
difficult to cope up.
education is the only ladder which can take them out of social and economic misery.
Yeah. Yeah. Yeah.
But those of us who already have this, right?
Yeah.
We see to that, we continue to get that, and we deny justice to the fellow citizens
Mm.
because we make the policy.
Mm. Mm.
So the policy direction
Yeah.
Mostly, we also saw that in the 1985 shareholder for-profit hospitals taking over healthcare.
Yeah.
And here also in the education also, it is the rich and the upper middle class who, are retaining their benefits,
Hmm.
not allowing others into the railway compartment. After once you get in, you don't
Hmm.
allow others to get in. This is what is happening.
The seat is mine.
The seat is mine.
And during all these 5 years of medical undergraduation and that 2 to 3 years of post graduation, you have to also tolerate the pressure from your uh, seniors and also HODs, and then also pressure from the public. When you go to the public hospitals to serve, right? So this is all a big thing to bear on your shoulders, on your mind, right? So after tolerating all these things, after going through rigorous academic education, after going through rigorous pressure from your seniors and professors, after tolerating the patients during your public service, you will become a doctor, right?
Yeah.
So you mentioned academic is a big challenge, like it's a difficult thing, not easy. But I'm seeing a illiterate calling himself doctor. Okay, he writes a nameplate, he puts on it on his shop, and aram se, like very easily he runs his hospital clinic, and we call it quack
I got the
doctors.
point. I got the point. I got the point.
I
I
I
got the
am
point.
confused. So I feel it is very easy in this country to become a doctor. Even today, though I'm not medically trained or I'm not medically certified, I can call myself Dr. Suman Bhokre, and no one bothers.
The government actually encourages.
Hmm.
The policies have always been very, very dilute in this region.
Hmm.
Actually, in the government circles, when you sit in the policy making bodies, they call them informal doctors.
Informal doctors.
They call them informal doctors.
Hmm.
And what they say is that without them, the healthcare system will collapse.
Hmm.
What they say is when there is nothing, at least they are there.
Hmm. Hmm.
This is the attitude in the circles,
Hmm.
policy making circles.
Hmm.
These are all the result of failure of the state
Hmm.
to allot money, invest in public health, invest in public hospitals, invest in public infrastructure,
Hmm.
invest in public human resources. That's what has happened.
Hmm.
They allot 1.1%.
Hmm.
And then the result is this. And now they want to legitimize them. They want to give them registration,
Hmm.
regularize them. This is what, it is something like, if a thief comes into your house,
Hmm.
you legally protect him by some way.
Yeah.
Something like that is
Something
they are
like
legit.
you give them a uniform and make them police.
That is well said. That is well said.
It's like you are giving them a search warrant.
Yes, yes, yes. That's what is happening. So throughout this country, you can see them everywhere
Hmm.
practicing with the impunity.
Hmm.
Even in the capital,
Hmm.
even
Yeah,
in the
yeah.
capital, even
Delhi,
in the
Mumbai,
national,
Pune, Hyderabad, Kochi,
you
everywhere.
you mean everywhere. They are there, and the politicians do not have the guts to stand up to them. Very, very unfortunate. Very, and whatever rules are there under the State Medical Council Acts
Hmm.
are toothless. They just pay a fine of 1,000 rupees and then go back to start doing the practice. They
Hmm.
are not criminally responsible for whatever they do.
Hmm.
So this is a catastrophe. For example,
Hmm.
when before 20 years, we brought it to the attention of the union government regarding the antibiotic microbial resistance which is emerging before 20 years,
Hmm. Hmm.
and we said that at least the antibiotics must be protected,
Hmm. Hmm.
and the government went ahead.
Hmm.
I think it was the first UPA government, went ahead and said that
mm,
Without a prescription, you cannot get an antibiotic anywhere in the country.
mm.
And you know what? In 1 week's time, they had to take it back.
Oh my God.
And even till today, it has not been enforced. It is there.
Oh.
It is there in the law, but not enforced. You walk into any medical store in India, you
Mm.
can get any
Yeah, any
antibiotic.
antibiotic. Yes, yes, yes.
This has not been enforced. The
Mm.
government gave an order to execute without any,
Prescription.
yeah,
Mm,
without any prescription, you cannot. But in 1 week's time,
mm,
officially they took it forward back.
mm,
They
mm,
couldn't implement it.
mm.
Simple thing. Today, now they are telling us prescribe antibiotics rationally. The government is telling us. The
Yeah.
government which cannot ensure that the antibiotics cannot be sold over the counter.
Mm, mm,
Anywhere you go, you can buy antibiotic, whatever antibiotic, even
mm,
tertiary antibiotics you can buy.
mm.
They cannot implement, but they are now harassing or telling us that you don't prescribe antibiotics without doing blood culture, urine culture. By the time
Yeah.
the
Mm,
in 3 or 4 days, so we are respecting their concern.
mm,
Antibiotic microbial antimicrobial resistance
mm.
is going to be the new pandemic.
Yeah, yeah, yeah,
Nothing is going to work in another
yeah,
10 years.
yeah.
So it is our responsibility. The responsibility of the doctors is the primary one.
Mm,
We are responsible. But
yeah.
then equally the government is responsible.
People in these capital cities, people in the towns, people in the urban will also go to these quack doctors for the medical treatment because they want to save money. They are least bothered about the consequences which they have to go through in future. What do you have to say for them? The message to the public.
Healthcare seeking habit, it doesn't come in a day. It takes at least 1 or 2 generations.
Mm,
Healthcare seeking habit
mm,
is high, at least in my state, that is Kerala.
mm,
And the one reason which I can see is female literacy.
mm,
Female education, the education of the women,
mm,
tells them that their children are safer in the hands of qualified people
mm,
and people with their reputation in their field.
mm,
So I think it's not only the economics,
mm,
it's also the literacy in the domain.
mm,
That health is important. If you look at the healthcare expenditure,
mm,
Kerala state spends, the people, ordinary citizen,
mm.
spends 2.5 times more amount
Oh,
than anywhere in India. 2.5 times
oh.
more amount
Mm,
than anywhere in India. So, that healthcare seeking habit
mm,
is the reason
mm,
where, if that develops, I think, but now the consumer education and so many things have developed parallelly in several other fields,
mm,
but that is yet to develop in the area of health.
mm,
So suddenly they get caught in a health emergency
mm.
where they are exposed to the corridors of a tertiary for-profit hospital,
Yeah,
which they cannot imagine what the difference between what
yeah,
they have
yeah.
been doing and then suddenly exposed to.
Mm, mm. Now, I see politicians interfering in the medical practice. So when you have a patient admitted in your hospital, and you are, you are in the way of, treating the patient. Now you suddenly gets a call from a politician interfering with the whatever it is, treatment, billing, and I've seen all these things. Is this all necessary? Political interference in the medical fraternity.
This is a reality. This is a reality. Today, the politicians think they are the masters.
Hmm.
Well, they are not. The people are the masters.
Yeah.
But it also reflects the refinement or quality of politics which is practiced in a state.
Hmm.
And I have been practicing in my state for the past 42 years.
Hmm.
Very rarely politics has affected us.
Hmm. Hmm.
Very rarely. and it is refined. Whenever there is an intervention rather than an interruption,
Hmm.
it has been refined also. It also depends on the type of politicians you get in a state.
Yeah. You are heading about 350,000 doctors in the country because you are a national president of IMA, which has 350,000 doctors associated.
Yeah.
Right. So if I ask you how unite you doctors are, then what you have to say?
We might not have been united before 20 or 30 years.
Hmm.
Today, with the fulcrum of Indian Medical Association
Hmm.
and the violence that has been unleashed on the doctors
Yeah. Hmm.
and the unfriendly legislations which are regulating the medical practice,
Hmm. Hmm.
doctors now know
Hmm.
that we are orphans in this country.
Very well said. Yes. Yes.
We don't have anybody with us.
Correct. Yeah.
So that is bringing the doctors together. The spirit is different now. It's not that we cannot retaliate.
Hmm.
It's not that doctors cannot. It's not that we are soft targets. We are
Hmm.
not soft targets.
Hmm.
I only need 1 hour.
Yeah.
I only 1 hour for the medical profession of the country to stand up,
Hmm. Hmm.
to tell me what we will change.
Hmm.
If the medical profession of the country
Hmm.
stands together for 1 hour,
Hmm.
leave alone one day, whatever is required by the medical profession will be provided.
Hmm.
But it is the chained hands of the medical profession
Yeah.
where we see our patient as our primary reverent source.
Hmm.
Whatever we do hurts the patient.
Yeah.
That keeps us chained. It's not that we cannot retaliate. We
Hmm.
can very easily say that somebody is blacklisted.
Hmm.
We can do that. We did not say anything. I can say that he is an enemy of the medical profession.
Hmm.
Somebody violating, causing a physical violence.
Hmm.
So much has been done.
Yeah.
We can very easily declare them as blacklisted
Hmm. Hmm. Hmm.
and announce it not to the public but to the medical professionals. See, this is what this gentleman has done to your colleague somewhere else
Hmm.
in a physical violence. A doctor was murdered in my
Hmm.
state last year. A house surgeon, a young budding
Hmm.
23 years old Bandhana, just 18 kilometers away from my town
Hmm.
in the early morning. And she was working at that hour as a house surgeon.
Hmm.
She was killed with an artery forceps of all the
Oh,
things,
oh, oh my God.
not even a knife, artery forceps.
Oh,
And everybody ran away. There were three policemen in the state.
oh.
They left that girl and ran away.
Hmm.
So, it's not that. Still, what we can do,
Hmm.
the power of the medical profession, we are hesitant to exercise that power
Hmm.
because at the end of the day, anything done in a similar fashion will
Hmm.
hurt our patients. That is not the job of the medical profession.
Yeah.
It is the job of the society,
Yeah. Yeah.
the country, to safeguard the doctors.
How easy it is to run a hospital? Because I know the medical equipments are not easy to purchase. They are very expensive, very, very expensive. You people buy expensive medical equipment. You people spend lot of money to build a good infrastructure so that you can render quality healthcare to the people. Running a hospital is not as easy as running a hotel, right, sir? You agree with me?
Yeah, yeah, certainly.
But people expect you to charge lesser, lesser day by day. Is that possible? How can you run the show?
Uh, well, it's so difficult to make money out of a hospital. Even the best of the hospitals, I
Hmm.
understand they make around 8%. of what they invest.
Mm.
8% is a very
But people
modest.
think the other way.
That's not true. That is not true. See, all investments like an ultrasound machine or something,
Mm.
they get updated every 3 years.
Mm.
They get outmoded. You need to buy a new ultrasound machine.
Yes.
That unseen investment which goes into an ICU or an operation theater
Mm.
is not realized. We are for our own. Nobody helps a doctor
Mm.
who takes a bank loan at the commercial rate.
Mm. Yeah. You don't get
We
any
start.
subsidy.
There is no subsidy. There is no subsidy.
Rice mills, factories get subsidy, but not doctors.
And also we get charged for our electricity, water, or you
Mm.
name anything at commercial rates.
Yeah. Yeah.
So the perception is not true. We have a problem
Mm.
of this perception of the people
Mm.
on what private hospitals, especially the small and medium ones run by doctors.
Mm. Mm.
We have an issue of perception.
Yeah.
That issue of perception of our image is so difficult to and you need to survive. You need to provide quality care.
Mm. Yeah.
In private sector,
Mm.
it's word of mouth.
Mm. Mm.
You go to a hospital, the services as well as the infrastructure is good. Then they do recommend you by word of mouth. We don't
Yeah.
do
Yeah.
an advertisement,
Yeah.
especially doctor run small practices. We don't advertise.
Mm. Mm.
So
Yeah.
there is absolutely no nothing business about it.
Yes.
But unfortunately, both the government and the law,
Mm.
they treat us as business enterprises.
Yeah.
The taxation is at business rate. I register my small hospital of 26 bed
Mm.
under Dangerous Trade and Offensive Practices Act of Kerala. How do you like it?
Strange. Sir, um, see, when the patient admits in the hospital, okay, there is some waste which is collected from the patient, right? I heard that, in fact, I know that the hospital need to spend huge amount of money to even discard this waste, patient's waste. Patient don't know
Biomedical
anything
waste.
about
Biomedical waste.
in
We
the name
call
of
it biomedical.
biomedical waste. It is expensive, right?
It's expensive, but it's a part of the by law. Whoever produces biomedical waste is
Mm,
responsible for. We came together in
mm,
Kerala,
mm,
the doctors of Kerala. We came together
mm,
to create a common plant in 26 acres of land
mm,
to dispose this biomedical waste
mm,
in an institution called Image.
mm, mm,
And today, 68 tons of waste is collected every day
mm,
by 68 big trucks.
mm,
And this 26 acres of land, we have 3 units of a factory
mm.
which disposes them properly. The entire biomedical waste is handled by IMA.
And your contribution in that project is remarkable.
it was my project. It was my project. It was done during my state presidency of Kerala in
Mm,
2001. And today we are a very proud holder of that property. During COVID time, especially,
mm,
during COVID time, we were able to sustain the state itself, protect the state itself,
mm,
entire state,
mm,
because of this. Because there was one biomedical waste disposal project which disposed all COVID waste
mm,
for no extra cost.
mm.
So
Excellent.
we made a difference.
Excellent. Becoming a doctor, was it your childhood dream? Because you became a doctor, but not just a doctor, not just an ordinary doctor. Now you are heading 350,000 doctors in the country. You are a national president, and Team Suman versus Human salutes you for this achievement. Let us know your journey from childhood till today, that is president of IMA.
My father was a professor of politics
Hmm.
and my mother was a headmistress.
Mm.
and my desire was history.
Mm.
I wanted to learn history,
Mm.
and that was my until I left the school.
Mm.
Well, my
Yeah.
parents are having much more experience in what life is,
Mm. Mm.
and I naturally accepted their decision for me.
Mm.
So that was the story of. But I still remember I read a lot of contemporary history, which can be, you can say, politics or economics.
Mm.
That's my hobby even today.
Mm.
From the PUC, when I really changed the track,
Mm.
it's an amazing experience and the aspiration because of something like
Mm.
in at all levels there is a peer pressure.
Mm.
That peer pressure at that school living stage is for medical college because
Yeah.
that gives us an aura,
Mm.
and
Mm.
that also kindled that passion,
Mm.
aptitude, or you call it as
Yeah.
aptitude in this thing. That aptitude is that that craving for that particular area
Mm.
of I told you that of unknown.
Yeah. Yeah.
And in the medical college, every day you get to learn something which is amazing,
Yes. 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 And that
which is
remains as an unforgettable memory throughout your life.
unforgettable. Every
Yeah.
day, every
Yeah.
day, you don't believe what you are hearing in your ears.
Yeah, my dad, even today, he shares all his hostel experiences, hospital experiences, classroom experiences with us. Great, sir. It was amazing talking to you, sir. Now we have come to a stage where I have this question to all my guests coming on the show, and you will certainly have no option to say no. You have to answer this. I am giving you superpowers in your hands to change something in this country. So, what that one thing is going to be? You have superpowers, sir. National President IMA has superpowers now.
You said so, not powers, but superpowers.
Superpowers.
I would like to go back to that era
Hmm.
when the doctors and patients trusted each other.
Hmm. Hmm.
Now the pain is we sacrificed 1,568 doctors in the COVID war.
Oh, oh,
That is counted by IMA, not by the government.
oh.
It may not be the entire data. With our limited resources, we counted 1,568 doctors died in COVID, because of treating patients.
Hmm.
Today, the government does not have any statistics, neither the name nor the number. This is the answer of the government in the parliament. We are hurt. As a profession, we are hurt. Our children and our doctors, they sacrifice life for the people. How are they lesser than the soldiers of Kargil? We defended this country. Did we not stop COVID?
Hmm.
Who did it? It's
Yeah.
our doctors. So we feel that the nation is ungrateful. There is no gratitude. There is no thankfulness. And instead, what is being given is something which is very unacceptable to us. So if you feel that something has to change, what has to change is the doctor patient relationship and how the society, doctors, and the legal profession they look at doctors has to change because the finest relationship outside the what we call as fiduciary relationship is the doctor patient relationship.
Hmm.
So if we cannot hold up, then I think the human civilization is going to lose something in its journey.
Hmm.
We are not definitely going forward. We cannot lose the doctor patient relationship or the ethics and etiquette of medical profession. They are treasures of the human civilization.
Yeah.
If this is lost in the way that it is progressing now, it is degeneration and maybe dark days. So if I get superpower, as you rightly said, I may not ask for materialistic thing, but
Mhm.
this humane approach of the profession to the doctors, to the patients, and patients contributing with love, warmth, and trust imposed on the doctors is what I would ask for.
Kadastu.
Yeah.
I'm joining my both hands together, bending my head, and paying you my respect. Namaste. Thank you so much for giving me this great opportunity to host you on Suman versus Human.
Suma, let me say this. I have
Yes,
gone
sir.
through a lot of interviews, but you made me really emotional.
Thank you so much, sir. Thank you.
You
Thanks a lot,
brought
sir.
out so
That's a
much out of me.
great, great, great motivation for me.
Thank you, Suma. Thank you so much.